48.1. The next to it, the blue chart, is South Asia. That's India, Pakistan, Sri Lanka, Bangladesh, etc. That is 40% of the problem. And then you come to the rest. You have the Middle East, which is not important because it's tiny. You have Latin America, which is okay. You have Europe, which is okay. And then you have East Asia and the Pacific, which is Southeast Asia and the islands in the Pacific, and that is for 15%. Now, these are figures which represent not just the magnitude of the health problem between countries, but also the magnitude of the health problem within countries. And so you notice that we have major problems of health in the population centers of Africa and Asia. And then you have another interesting chart. Don't worry if you can't read it. This is a chart on life expectancy, the relationship between health and life expectancy. And you find the dipping chart here, this one, is Botswana. And the rising chart is Costa Rica. So two countries are compared here. And you notice that if the standard of living is going up, and both of these are developing countries, if the standard of living is going up, you find that life expectancy improves. So the life expectancy in Costa Rica is constantly going up, whereas the life expectancy in Botswana is constantly going down. And so once again, what it means is that you have a relationship between health, poverty, and life expectancy. So poverty is not just poverty of opportunity, it is also poverty of life. You are early death if you are poor. And we have these charts. These are World Bank maintained charts. So you've understood that the Millennium Development Goals understood all this and therefore laid so much emphasis on health. So what is the problem? I mean, since we know the problem, why can't we find solutions? What is the problem? What's so complex about it? Now, if you analyze, there are 3 or 4 reasons why the problem is complex. The first is the question of low priority. Knowing that health is important, we still attach very low priority to health. In all countries, developed and developing, it is political problems which dominate, not health problems. And you will find that the discussion is not about health, but it is about politics, it's about wars, it's about security and safety and things like that. And you notice that in the budget, for example, once again, I'm sorry to give you statistics, but the budget for peacekeeping in the United Nations is approximately going to be $7 billion in the year 2008. The budget of the World Health Organization is less than $1 billion. And so peacekeeping is 8 times more important than health, just from the point of view of the statistical budget. Why is it that health is not given proper priority? Because in most countries, it is seen as a consumption problem and not as an investment problem. In other words, people say, this is like food, it's consumption. They don't see that health is a production issue, and therefore good health is an investment in better production, not an investment in better consumption. Point number 2 is inadequate funding. And I now want to go into the global statistic. We have statistics maintained on what is called development assistance for health. How much money is going from the World Bank and all international sources towards health specifically? And we know that that figure today is $8 billion. In other words, the amount that is being injected into health is 1/3 of the amount that is really needed in health injections. And internally, most countries are spending less than 0.5% of their gross domestic product on health issues. So, inadequate funding was point number 2. Point number 3 in the problem is research and development. There's a lot of talk about R&D all the time. But if you look at research and development, out of 1,200 chemical entities, which means drugs, which have been developed between 1975 and the year 2000, 1,200 new drugs. Only 13 of these drugs are specific to tropical diseases and primary diseases. In other words, out of 1,200, just 13 are dealing with the majority of the problem, which is primary health care in Africa, Asia. You remember the chart that I showed you. In other words, research and development is not going where it is needed. It is going where it is most profitable. Because if you find a pill for malaria, you're not going to get any money out of it. But if you find a pill for cancer, you're going to make a lot of money out of it. And so pharmaceutical companies have very little interest in doing research in primary health care, but great interest in doing research in tertiary health care. And finally, linked to this is the problem of generics. You know that in research and development, pharmaceutical companies constantly say, we do research and development, we have to spend a lot of money, that's why we sell our pills expensive. It's utter nonsense. It's nonsense because we are in a period of recession in the United States, and yet the drug companies are making profits. Only 3 people are making profits in the United States, 2 in fact now. They are pharmaceutical companies and oil companies. And so we can understand oil companies making a profit because they are selling you gas cheap, expensive, and you are, or most of us, are foolish enough to pay more for our gas and not ask what are the profits of these oil distributors in these countries. But pharmaceuticals are also making money, and they are making money not because they are spending on research and development, but because, like the oil companies, they are willing to sell at expensive prices to the common man, and the common man is willing to buy products at expensive prices. Now, in generics, generic means you take a pill and you open it up and analyze it and reconstruct it from scratch. This is, in other words, copying the formula. Now, generics exist. We have the case of the HIV/AIDS problem. HIV/AIDS have a pill, or rather a combination, which is called the ARVs, the antiretroviral drugs. And they are expensive. So if you have AIDS, it costs you a lot of money to get treated, up to $10,000 a month. India was willing to produce generics at less than $100 a month. And the companies which owned the patents for the ARVs were not willing to allow generics because they said, we want to make a profit and we refuse to allow you, Mr. India, to manufacture the same drug at 100th or 1,000th of the price. In other words, we want to make money out of the death and suffering of others. That is the key point. Should the profit be dependent on death and suffering, or should death and suffering be something which is public service? Now, we face this problem for more than 2,000 years because the fundamental quotation in health is by a Greek doctor, Hippocrates, and all doctors in all countries of the world have to take an oath about serving the public, and that's called the Hippocrates Oath. And the Hippocrates Oath is that you, as a doctor, will provide service to those who need health, not make a profit out of those who are suffering or dying, and therefore you want to make death. And so the generics problem, we faced this